If you are over 60, have you ever gone shopping, carried just a small bag, and suddenly felt out of breath? Or were you talking and suddenly felt dizzy, then thought, maybe it's just from lack of sleep? Many women have experienced exactly these moments before discovering they were signs of a heart attack. According to data from the American Heart Association, more than 40% of women hospitalized for a heart attack had experienced such subtle signals, only no one had warned them in advance. In this video, you will see clearly why small signs can have big meaning, how to tell the difference between normal tiredness from aging and true heart warnings, and most importantly, what you can do right now to prevent them. This is not rumor, but knowledge confirmed by medical research, helping you take control of your health and protect your loved ones. Sign 1. Flu-like symptoms without fever. Cold sweats or a sluggish feeling like the start of the flu are often dismissed as stomach problems or the weather. But for many women, these are early signs of a heart attack. The symptoms may last for several days without fever or cough, just a vague discomfort in the upper abdomen along with fatigue. Research in the United States shows that more than 40% of women hospitalized for a heart attack had experienced flu-like symptoms in the week before. Most ignored them, buying cold medicine or resting at home while their heart was already in danger. One case in Michigan last year was a clear warning. A 64-year-old woman went to a clinic only because of ongoing nausea. No chest pain, no shortness of breath. When doctors checked, they discovered she was having a silent heart attack. Thanks to timely treatment, she avoided serious complications. The important point is that in older adults, especially women, heart attacks often happen without the classic chest pain. Instead, harmless-looking signs like nausea, dizziness, or what feels like the flu may actually be the body's first urgent message. Sign 2. Dizziness or feeling faint. Dizziness or feeling faint often happens suddenly and without warning. Many older adults think it is just low blood pressure or fatigue, but in reality, it can be one of the earliest signals of a heart attack. According to medical data in the United States, this condition is common in people over 55 and is easily overlooked, especially in women. Cardiologists emphasize, if dizziness comes with fatigue, nausea, or shortness of breath, think immediately of reduced blood flow to the heart, which can lead to a heart attack if not detected in time. A real case. A 63-year-old woman often felt her vision darken when standing up from a chair. At first, she thought it was because of hot weather, but after it happened several times, her family took her to the doctor. The results showed a mild blockage in her coronary arteries, and thanks to early intervention, she avoided a serious heart attack. The key point is this: repeated dizziness is not just a normal sign of aging. When it comes with loss of balance or trouble standing steadily, it may be the heart warning that it is under strain. Do not wait. Get your heart checked as soon as the symptom happens regularly. Sign 3. Cold sweats without fever. Cold sweats that happen while resting should never be ignored. The important thing is to listen to your body. Cold sweats when you are not active, especially if they come with fatigue, dizziness, or nausea, must be considered a serious warning and checked by a doctor immediately. Have you ever seen a loved one suddenly break into a cold sweat at night without having a fever? Leave even a small comment to remind others how real and dangerous this can be. Sign 4. Pain or numbness. Spreading down the arm, especially the left arm. One of the classic but easily overlooked signs of a heart attack is pain, heaviness or numbness spreading from the chest down the arm, most often the left arm. The symptom may start very mildly, just a tingling feeling in the upper arm, or a dull ache as if from carrying something heavy. Many women mistake this for muscle or joint pain, especially as they get older or when the weather changes. However, according to the American Heart Association, more than 30% of women with a heart attack reported pain spreading into the arm before the attack became obvious. A real example: Linda, 62 years old, felt only mild aching in her left arm for several days. She thought it was arthritis, but during a routine exam, the doctor found signs of reduced blood flow to the heart, and timely treatment prevented a major heart attack. The lesson is clear. Pain or numbness running into the arm, especially the left, must be treated as a possible heart warning. Do not assume it is only aging or bone pain. Check your heart before it is too late. Sign 5. Chest discomfort without severe pain. Many women believe that without sharp chest pain, it cannot be a heart attack. In reality, discomfort in the chest, such as pressure, burning, or a heavy feeling, may be the first signal. This can last for a few minutes or come and go, often mistaken for indigestion or fatigue. Doctors emphasize that for seniors, especially women over 60, vague chest discomfort should always be checked. Even if it is not severe, it can be a warning that blood flow to the heart is blocked. Sign 6. Shortness of breath while at rest. Shortness of breath, even when sitting or lying down, is not normal aging. When the heart struggles to pump, fluid can build up in the lungs, causing difficulty breathing, especially at night. Many women report needing more pillows to sleep comfortably or waking suddenly gasping for air. This is one of the most important early signs of a heart attack. If breathlessness appears suddenly or worsens, get medical help right away. Sign 7. Pain in the neck, jaw, or back. Instead of chest pain, women may feel aching in the neck, jaw, or back. This pain may be dull or sharp and is often misdiagnosed as dental issues, arthritis, or poor posture. But these are well-documented signals of a heart attack in women. The American Heart Association has confirmed that jaw and back pain are more common in women than men during a heart attack. If this pain appears without a clear cause, especially with fatigue or sweating, it must be taken seriously. Sign 8. Unusual fatigue. Lasting for days. Feeling weak after heavy work is normal, but ongoing exhaustion, even after rest, is different. Women often experience this sign for days before a heart attack. It may come with dizziness, poor sleep, or mild nausea. If you feel drained without reason, treat it as a red flag. Early testing can detect heart problems before they become emergencies. Sign 9. A sense that something is wrong. Many women describe a vague but strong feeling that something is not right, even without pain. This sense of doom, restlessness, or anxiety is the brain's response to reduced blood supply in the heart. When several heart attack symptoms in women over 60 occur at the same time, last for days, or repeat, the most important action is to call 911 immediately. Never try to drive yourself to the hospital because you may lose consciousness at any moment. When calling for help, clearly say you suspect a heart attack. This clarity helps emergency staff respond quickly and prepare proper treatment. Many women have shared that they felt something was wrong, but because there was no obvious chest pain, they endured it. Some never made it to the hospital. That is why you must trust your instincts. Intuition is not weakness or overreaction. It is survival instinct, the way your body speaks before it is too late.